Morning, everyone right to go? Very good. We have 24 active cases of coronavirus in Victoria. That's 3 new cases. They're all in hotel quarantine, so no additional community transmission or local cases overnight. Now, testing is a little more involved than it would normally be, so bear with me as I take you through these numbers. 14,612 test results have been received from yesterday. A further 8,000 tests have been processed this morning, so since midnight, so I can't include those in the number, but the real number in terms of results received is closer to 22,500. That'll be reconciled, if not later in the day, then in tomorrow's numbers. So we're doing additional runs, we're doing some fast tracking, where therefore have more tests coming through, and we've not used a cut-off. We're trying to make this a rolling coverage, if you like. What I can also say is there's a further 6,000 swabs that were taken yesterday that are in the lab but have not yet been processed. So that's a long way of saying thank you to many tens of thousands of Victorians who've come forward and got tested. It was a very big testing 24 hours, and I'm very pleased to say that they've all been negative. That is exactly the outcome that we were after. Big community response and no new positive cases. The surge in demand, we're trying to step up to have as shorter wait times as possible, but as I've said to you many times now, it's got to be done carefully. You can have as many extra sites as you want, but they all have to be done in a meticulous fashion. We don't want infection control breaches at a test site of all places. So I'm very, very grateful to all of those who've come forward and got tested, and particularly for those people who've had to wait. We have stood up additional sites, and we don't rule out standing up even more if we need to. Some of the technology we're using at the moment, where people can in real time look and find the wait time at the test site they want to go to, that means they can make an informed choice and go where perhaps a little further away from home, but a quicker testing facility based on demand. We also reach in and talk to people when they're in the queue and maybe direct them elsewhere where there is a shorter queue, but it is the most important thing. Any symptoms whatsoever, get tested, and get tested today. And profound thanks to everybody who's done just that since we asked them to do that, and indeed throughout this global pandemic. I'll ask Brett to speak about genomics in a minute, because that's back and it confirms our working theory. I also just wanted to speak briefly to the effort that's been made by a big team. We've had hundreds of thousands of text messages sent out. All those tests I just spoke about, they've all been processed in really good time. There's been hundreds and hundreds of interviews conducted. This coronavirus detective work is being done in a textbook fashion, and that means it's often behind the scenes, but it's 24/7, and the team are doing a fantastic job, and I'm proud of them and very grateful to them, and on behalf of all Victorians, I thank them. To that end, those very close contacts of the 26-year-old Noble Park gentleman, of which there, after a full reconciliation, 17 of those, all 17 have been tested, 16 results have come back, 1 still in the lab, and all 16 of those are negative. So those that he has spent the most time with during his most infectious period have all, to this point, come back negative. It doesn't mean that they might not test positive at a later point, and that's why them completing the isolation and doing as we've asked them to do is so important. But these are good signs, very good signs that we caught this in good time. We've spared no effort to run this to ground, and whilst there's still days that will be relevant to us, tomorrow not over yet, these are in some respects the very best outcomes that we could have hoped for. I just say again, it is critically important to get tested. It's critically important to think back whether you were at any of those exposure sites during the relevant period and to act accordingly. I'm very, very proud of Victorians. I said late on Wednesday night that Victorians knew what to do, and they're proving that's exactly right. They know that this has to be taken seriously. They know that if we all work together and play our part, then we will run this outbreak to ground, we will contain it, and we will go back to defending that COVID normal with recovery and rebuilding, and that almost normal way of life being protected and preserved for the medium and indeed for the long term. National Cabinet's on later on today. You may have some questions about that. I might now throw, however, to Brett to talk about the genomic sequencing, and then Jerome can speak about testing, and then we're happy to take any questions you've got. I'm sorry to say I do have to head off to that meeting for 10, but we'll try and be as quick as we can.
Thanks, Premier. Good morning. So the sequencing has been done. Our reference laboratory has identified the sequence in our case as the B117 variant. That's the variant that was first identified in the UK, so the one that people understand to be the UK variant. It is a more transmissible variant of concern. We'd always worked on the assumption that it was going to be this variant. That's because 4 of the 6 residents who tested positive at the hotel had that variant identified in them. Where exactly it's come from is still to be determined. We do need to marry up that genomics information with the epidemiological information, so the CCTV footage, the interviews, to really understand how transmission might have occurred. As we've said previously, no apparent breach in infection prevention and control protocols or PPE. We really do manage that risk to the fullest extent possible, but we need to re-examine it. We need to look at it over and over again. Droplet spread is managed when you're more than 1.5 metres away and you're wearing PPE, but airborne spread, aerosolised particles can move even further than that. So we just need to be as precautionary as we possibly can. We'll re-examine that, but at the moment we're confident it's not been picked up in the community. It's been picked up from one of the residents in the hotel.
Thank you, Brett. Good morning. So it's been a very strong opening 36 hours on this particular outbreak. As the Premier has said, 16 of the 17 household contacts have tested negative so far, and that's an encouraging step. Of course, all those 17 household close contacts continue to do their isolation for the full 14 days. I can also report we are now working with 743 workplace contacts, the second ring of our approach. They have all been contacted by their respective employers, and they are being called and ensured that we get them tested over the coming days. It's very important for us that we get hold of those workplace contacts and ensure that we really establish whether there's any other leakage from that hotel quarantine period into that workforce. Of course, all those 743 people were tested daily throughout their entire duty at the hotel. The third ring of our approach, of course, is the 506 Australian Open contingent who were undertaking their full quarantine in the hotel during this period. They have all been tested yesterday. Negative results will come through during the course of overnight and during the course of today. And as those negative results come through, they will be released on the basis they have conducted and been very tightly contained within their hotel quarantine system. But we are keen, of course, to ensure a full abundance of cautions approach to make sure that outer ring is also signed off and that work has been completed yesterday. We have 299 people so far who have been identified through our 14 exposure sites. My thanks in particular to the organisations, the venues for their contact tracing systems, their QR code systems. That 299 number, I suspect, will continue to increase slowly over the coming days as more people come forward. And again, I'd urge all Victorians, please check our website. We have full details on those 14 exposure sites. Those exposure sites have not changed as we're still dealing with only one positive case, but it's important that we identify anybody who may have been at those exposure sites at those times, and we'll continue to work with those currently 299 people to ensure that they are tested and they continue to do their full isolation period. It's very important to us now that we really keep control of this and we run this to ground, having made a solid start. With regard to testing, I can confirm that the Premier's, as indicated, we're around 22,500 tests completed, for which we have negative results from yesterday, with a further 6,000 or so swabs on the machines right now, and those results will come through during the course of today. I'm also pleased to confirm we've got 96% turnaround within 24 hours of all those tests from yesterday, and my thanks to our labs for the hard work that they're putting in overnight and continue to put in all the way through this to ensure that people get their test results quickly so they know where they stand, and we can support those very few people who may turn positive if indeed they do. Finally, with regard to testing, my thanks to the gentleman who turned up at 5:30 this morning at Springer's Leisure Centre to get tested. We have all of our testing sites in the southeast open at 8 o'clock this morning, and they'll be open for the full 12 hours. And again, we had sites running beyond 8 p.m. yesterday. Again, my thanks to all the teams that are out there doing it hard in a very humid day yesterday and a somewhat windy day today. But that's very important that we see that a really good response from Victorians is being supported by a fantastic workforce that are making sure those tests get done safely and efficiently, and we'll continue that work today. We stood up 5 additional sites yesterday in the southeast, we will also stand up an additional site today at the Dendy Public Golf Course to again provide more capacity for Bayside people to come forward and get tested. And then finally, with regard to our website, we are now providing more real-time updates on testing queues on our website. I'd encourage all Victorians to please use our website for any information. 690,000 people did that yesterday. It's great to see as we get better information, more real-time information onto our website, that people are using that information, and my thanks to all, everybody who's done so. With that, I'll hand back to the Premier.
And I should just also add that wastewater remains clear of any signs of the virus. So we've upped the frequency of that testing, but it's not providing anything that we would be worried about. Happy to take any questions if you
Can I ask Brett, please, can Victorians feel more comfortable with where this situation is heading now than we might have this time yesterday?
Oh, certainly every day with thousands and thousands of tests being done, all coming back negative is assuring. The fact that close contacts, 16 of 17, are all negative, one pending, is also a positive. But the incubation period is 14 days. So even people who've tested negative, as we've asked, need to complete their 14 days of quarantine. They could become symptomatic in the remainder of that 14-day period. They could test positive. So there's a long way to play out, is what I'd say.
But the hope would be that if there are more positives, ideally they'd be among people who are isolated.
That's right. So, getting in contact with people early, making sure that they're quarantining is really key, and getting that early negative test is obviously important, because if they turn positive later, we know that they haven't been to new sites exposed to other people.
Just on the genomics, the case in the worker to a particular positive case, and was it that last person who left the hotel, I think, on the 22nd?
So we need to look closer at exactly whether we can say definitively. We probably can't say definitively if it was one particular individual out of those 6 positives. But as I say, we do need to marry up the evidence for the possibility of transmission. If there was never any contact with the worker and one of those players, then the hypothesis becomes a bit tricky. But we'll look at all of that together.
If the genomics aren't really close between those two, would you hypothesise that perhaps there's another link between? Would you be able to tell that?
It's pretty hard to tell. They are a very close match. But you can have a very close match even if there's one intermediary person. If we can't see a clear contact between the case and a resident, we need to think about an intermediary person. We also need to think about the possibility of surface transmission, and we'd look into that, of course.
Is it surprising that none of these close contacts so far, besides the one I guess that's haven't tested positive, considering the highly transmissible UK strain? That surprises.
I'm a little bit surprised. That's why I want to emphasise that people can still test positive in this incubation period. It is a highly transmissible virus, more transmissible than your standard coronavirus before these variants emerged. But there is sometimes play out, and we have tested people relatively early in their exposure period, so there's some days to go yet.
So because this man has the UK variant, should Melbourne be declared a hotspot?
Well, it's really up to other jurisdictions to make decisions about travel for their purposes, which is what they're doing. But border closures have been a control measure. They've done their job, so I'm not going to criticise those decisions at all.
That's what you'd be doing if this happened in another state?
Oh, we'd make those decisions based on a whole bunch of elements that relate to whether it's clear where it's come from. Exposure sites under control, people being chased up, all of those things are relevant.
Why won't workers at factory quarantine wearing N95 masks? Isn't that something you would do now?
So we're going to look into PPE standards. It's really for CQV. They've had IPC protocols in place, but we re-examine every time there's an incident, every time there's a challenge as to what more can be done.
Do you also need to look at continuing to test people perhaps for 7 or 14 days after they've completed their shift?
Yeah, I think that's something to be explored. It's a tricky thing. These are people who finish their work day, so there are issues around how that happens and what entitlements they have as workers on their day off.
And somewhat on that note, with the tennis players, what is the testing regime for them now, and should it be stepped up considering what's happened here, whether it's 7 or 14 days after that?
No, we've made a risk assessment. They're really being treated as for orange zone arrivals, so to isolate until they get a test, and when they get a negative test, then they're free to go about their business.
And how worried will it be if you can't work out how this transmission's happened? Would that not suggest that it could just happen again in other hotels?
I think we always work on the assumption that any infectious person can spread it in a myriad of ways. We need to be as precautionary as we possibly can with distance, with protocols, and with the PPE that's being used. But as I've said, airborne transmission is probably more likely with variants of concern. It's always been a possibility, but it's going to be a bigger risk factor going forward. So we need to bear that in mind as we tighten every element.
Are ventilation levels good enough in the Park Royal and in all of the hotels?
Look, I think Alan Cheng spoke to that yesterday. I'm not the expert in that area, and I don't have all of the details. Again, CQV have gone through a review of ventilation across their hotels. Some of them are more amenable to changes than others, but there are more than 2,000 people in quarantine. Not every single room will have hospital-grade ventilation standards, but we are doing everything that we possibly can to review that and to make sure that we're addressing the risk of airborne spread.
I was looking for the Premier, if that's okay.
Sure.
Where are we on the hotspots in Perth, with the red zone, sorry?
Minister Foley will make some announcements about a change there, which will be favourable. It'll go from red to orange. If he's not already made that announcement, he will make it fairly soon.
Premier, you spoke yesterday about the notion of halting international arrivals. You said it was an open question. Is it still for you as you go international?
Yeah, I think there are many open questions. If we look at these mutant strains, so much more infectious, many questions that can't be answered at the moment. And let's just be clear about this though, we've got a situation where we've built a model, everybody else in the country is copying that model, and we're giving active consideration to strengthening our model even further. That tells you something. That tells you that the enemy, the challenge, is more dynamic, more difficult than it's ever been. So we have to, again, make these constant judgments about risk. And I think there are other First Ministers today will speak, I think, about regional facilities, all sorts of different things. A stronger partnership between governments, both national government and state governments, to deal with this challenge. Again, the most important thing that I think should be our primary focus is getting every vulnerable person in the community vaccinated as fast as possible. That's what we have to be focused on. Those who may well die if they get this, and we'll get an update on the vaccination rollout today.
Do you want to pause though, given how long that vaccination is going to take?
No, I'm not at that point yet, but I do think there are some debates and discussions to be had, and we're happy to contribute to a better understanding across the country of the risk that we face right now. And I think it's very clear that it's different than what it was a month ago or six months ago. So it's always appropriate for us to have a sensible, rational discussion about what each of us have learnt and what that means. And if you're not prepared to ask those questions and really analyse these things properly, then you're essentially letting some risks just slide. And I'm just not prepared to do that. That's why we run a program that does not have capacity for 4,000 or 5,000 people, because we do it differently to other states. We have no tolerance for risk. But we do also acknowledge that you can't make this 100% risk-free. But these developments, and not just the Noble Park person, the 26-year-old gentleman, but also the room-to-room transmission where there'd been no contact. It's good that when you look at the CCTV, no one's done the wrong thing, but at the same time, that does present a really significant challenge. How did these infections happen if there's been no breach? We all have to factor that in, I think.
Do you have a position on non-hotel quarantine that you'll be taking the national challenge? Do you think
Not that I'll be, no, not a formal position, but I think that there is some merit in a network of bespoke facilities across our country that are jointly constructed, jointly operated, and not just for a pandemic. I think they can be very important in lots of different ways. I spoke with Mark McGowan last night about a whole range of different issues, and he's got hundreds of people that are out of their homes because they've got bushfires raging there. Having a facility that could be used, whether it's for these purposes or for other things, I think would be a good thing. But I just again make the point, whilst being, as some have said, a facility in the middle of nowhere might be lower risk than a city hotel, it won't be zero risk because there's still staff that'll have to work there, and unless they're going to quarantine as well, so a kind of fly in, fly out model, then there'll always be some risk. It's not zero risk we're chasing, because I don't think that's possible. That's the borders go up and no one gets in. I don't think we're talking about that, at this stage at least, but we have to look at what's happened, not just here, but in Brisbane, in Adelaide, in Sydney, in Perth, and learn from that and build the best system we can.
Business Victoria is asking for some grant money back. Isn't that unreasonable in the circumstances?
Oh, look, I'm not briefed on that, but I'm happy to follow it up for you. I know of it, but I'm not certain of the details. Again, I'm more than happy to chase that up.
Who were under the pump enough that they were given a grant?
Yes, and I'm not certain why it is they've been requested to provide some or all of that as a refund, but I'm more than happy to follow it up for you, James.
I mean, just on tests,
Yes.
I was surprised to see that they were waiting queues up to 3 hours, some people getting turned away from testing sites. There are also reports that people were getting turned away if they weren't showing symptoms. But just on the test numbers, I think it's surprising that there's only 14,500 tests. I know you spoke earlier that it's close to probably
23.
20,000. But would you really like to see double that?
Well, look, I think that we've been fortunate across the entire pandemic, many millions of Victorians presenting to be tested, and whenever we've asked people to come and do that, they have. Just to be clear, so 14,612 plus another 8,000, that'll be, they're after midnight, so they'll be reported definitively in tomorrow's numbers, but we have those results now, so that's closer to 22,000, closer to 23,000 in fact, and I can confirm there's another 6,000 swabs taken yesterday that are in the lab. We just don't have the results back from them. So I think that's a pretty strong testing performance, and I'm very grateful, but I'd always encourage, as you've heard me literally thousands of times, I'm always encouraging people to test because there's arguably nothing more important.
You said earlier that Victoria doesn't have the same tolerance for risk that other states do. Will you be communicating, in light of what we've seen over the past couple of days, will you be communicating to your state counterparts that they should have less tolerance for risk than they have?
Oh, they've got to run their own systems, but it's not a mystery to any of them, the very low tolerance for risk that I have and that we have. And I think to be fair, it's very encouraging that as these variant strains have come in, these mutant strains have come in, other states and territories, in fact all states and territories as I understand it, have at least committed to copy our model, or have in fact copied our model. What I'm indicating is the last few days give me, I'll boldly predict, I think we're going to strengthen our model further. So there'll be other things that have to change across the country, and that's good for everybody, because a problem in Sydney is a problem in Melbourne and all the way around. That's what we've seen. Black Rock didn't start here, but it got here. We all have to be alert to the fact that the challenge we face is changing, and that'll be part of the discussion today. Just finally, because I don't normally leave until you've asked all your questions, but I do have to get to this meeting. The message to every single Victorian: thank you for the part you're playing, but if you've got symptoms, if you've been at an exposure site, off the website during the relevant period, please come forward and get tested. We'll get your results as fast as we can. Yes, there are some queues, but they're not perhaps as bad as you might think, and we are moving people around so that we can share that testing, share the testing capacity and minimise the wait for people. The most important thing, get tested, and get tested today. You'll have our gratitude, but you'll also have played a powerful part in containing this virus, keeping yourself and your family safe, and every Victorian family safe. Thanks very much, guys.